More than 4 months ago, Niagara Health cut the hours of operations at urgent care centers in Fort Erie and Port Colborne. The reason given was staff shortages. Niagara Falls MPP Wayne Gates and healthcare advocates are pressing the provincial government to step in. Maria Saru has the details.
Healthcare advocates across Southern Ontario have joined forces for a common cause. Led by Niagara Falls MPP Wayne Gates, they're calling on the provincial government to restore 24/7 service at 2 urgent care centres in Fort Erie and Port Colborne. At Queen's Park yesterday morning, they presented petitions signed by more than 4,000 people.
I want to be clear. This is completely unacceptable, and I'm calling on this government to do the right thing. By using emergency funding and sending in appropriate staffing, we can ensure Fort Erie has the 24/7 health care they need and deserve.
In July, the urgent care centre at the Douglas Memorial Hospital in Fort Erie stopped accepting patients between the overnight hours of 10 p.m. to 10 a.m. The hospital network cited staff shortages, saying it can no longer keep emergency departments operating in Welland, Niagara Falls and St. Catharines without reducing hours in Fort Erie and Port Colborne. I'm in Fort Erie, where community members are telling me that they've suffered from the lack of around-the-clock access.
I'm disgusted with what they've done I'm very upset about it. To think if something happens to my husband or my mother, I'm just going to call an ambulance. There's nothing else we can do.
I have an elderly dad who's not well. This town has seen a boom in growth, and we need the same as people need in the cities.
Gates is the NDP's official opposition critic for long-term care. With him at the legislature were healthcare advocates from the area.
It is within the legislative power of the Minister of Health in Ontario to require public hospitals to provide particular services and level of those services.
A spokesperson for the Ministry of Health said in an email on Wednesday that health services are responsible for their own day-to-day operations. However, the ministry has been in contact with Niagara Health and received assurances that patients would continue to have access to critical care in the region. When reached for comment, a spokesperson for Niagara Health also said via email yesterday the urgent care centres are not for emergencies and staff would coordinate a transfer to an emergency department if required. Maria Saru, CHCH News, Niagara.